Thank you, George. That was a great opening. And I, too, want to welcome everyone to this session and really thank both George and David for their leadership over many years in this field. I want to first start out by thanking our committee. And I want to acknowledge them at first, which is, first it was co-chaired by Jacqueline, oh, there you are, Jacqueline Martinez-Garcel. Jacqueline, why don't you stand up? And I'll ask the other members to stand up who are here. David Hawkins. I don't know if David was able to make it. Carrie Ann McGeary. Kevin Nolan. Wynn Norton, who I know is here right in front. And Mary Pittman. So thank you very much. I think we're going to, it's still not working. Just a quick test there. Then I wanted to talk about there's 4 key purposes of this workshop. The first is to explore, as George talked about, the different meanings of spread and scale, of programs, policies, practices, and ideas. And we're in for a wonderful presentation from Anita, who will kick us off with her keynote on that topic. The second is to learn about a variety of approaches to spread and scale. And the third is to explore how users measure whether their strategies of spread and scale have in fact been effective. And finally, a fourth purpose is to discuss how to accelerate the focus on spread and scale. Hello? Yay. Okay, I gotta turn this one off. Okay. And on that point of acceleration, one of the things we're really trying to do in this session is to accelerate change, as both George talked about and I just talked about in terms of the fourth area. And in our many workshops on population health, I think we've learned a lot about bright spots. We've learned a lot about population health innovations. And there's so much going on, and all of that is really great. We're at a point now where we can and we should consider accelerating change by focusing on spread, scale, and sustainability. And I know there's lots of different meanings to that, and we're going to hear a lot from Anita on that, but the way we think about it is that what we want to do is get to how we get to more locations, how we get to more people. Spread and scale is about how we get to the right infrastructure and the right financial structures that are put in place so that it can support continued capacity so that we can multiply impact. And ultimately, if we want to get to population level changes, we're going to need to change the way we work. Right now, there's pockets of innovation and all of that's great, but it's disconnected. People are working on the same topics and not working together. And so we really want to get to a place where innovations are spread, they're tested first, spread and scaled, and there's a continuing feedback loop to make that happen. Many of you know that we are now, we have a project called Moving Healthcare Upstream, which is funded by the Kresge Foundation, co-directed by myself and Dr. Neil Halfon. And what we're trying to do is create a system, a learning system, an ecosystem that fosters innovation. And I didn't realize this was animated, so I'm sorry about that. I'm going to try to get to the first is the area of testing and innovating, which we've been hearing a lot about in our Population Health Roundtable. And what we're trying to do is test what works. And then we're going to try to spread what works. And then the idea is to put it on an open source platform to disseminate the knowledge and strategies. And what we're trying to do in testing and innovating is finding those promising tools and strategies, and not just finding those, but figuring out how to put them in place so that they can be scaled. And that in itself is a different way of thinking. And then it's not just about that, but it's about sustainability, and that speaks to policy change. So ultimately, we're trying to test and spread, and then we're trying to also put things on an open source platform so that they can, in fact, be adopted. And at Nemours, we've been doing this in a number of different areas. I'm going to give you one example, and that's the example of our work in child care centers. We have been working to improve healthy eating and physical activity behaviors in child care centers, and we now run a national program to spread this intervention or strategy that we developed in Delaware to 9 other states. And what we've learned in that process is it's not just, it's not just developing the intervention, but you have to think about spread, scale, and sustainability at the front end. And so when we're thinking about the strategy, we have to figure out, well, what is it that we want to spread? And so in this example, we're spreading a national curriculum that fosters healthy eating and physical activity through a learning collaborative method. So that's the thing we're trying to spread. And then we have to figure out, well, how? How are we going to spread it? And how we decided to spread it was to come up with a national technical assistance center and have state adopters, a state delivery system where states adopted that. And the reason for that was because we wanted to make sure that the program was sustainable in states. And so we wanted to work with state partners so that they would incorporate healthy eating, physical activity training into their current early care and education systems. So it's again about building that systems infrastructure. And lastly, we want to accelerate. We want to make sure that we're taking these learnings, putting them on an open source platform so people can really learn from what we're doing. And part of that is getting the materials out there, but the other part of that is policy change, creating the demand for the interventions on the ground. So for example, in Delaware, we ended up pushing out different strategies, but then we also worked on policy change. And so in Delaware, we changed the we worked with others to change the child care licensing rules so that healthy eating and physical activities was a requirement of child care licensing. So you want to create the demand for the work you're doing on the ground. It's both policy and practice change together. So we structured this session today in the following ways. We have 2 keynote speakers, one in the morning and one in the afternoon to kind of put bookends on the day for us. And then we have 3 panels of case studies to illustrate different ways to spread and scale. And another way we decided to try it a little differently was ahead of time, we asked folks who are on the panels with the case studies to answer these questions that I have here so that they could articulate the what of what they're doing so that the sessions today could focus on how. How are people spreading and scaling? So I hope you've had a chance to read the materials. That was the homework that Alina sent out to at least the Population Health Roundtable folks, so that we can really today focus on how. And we really want this to be an interactive session. So our agenda looks like this. We're going to begin with defining spread and scale, and then we'll have the 3 separate panels. The first panel has different approaches to spread and scale. The second panel has examples from other sectors, because a lot of other sectors have been focusing on this. And the last panel is a panel of lessons learned from the tobacco control experience. So we have a very full agenda, and we're going to end with Joe McCannon, who's going to talk about what's next and really bring it all home for us. So with that, I don't know if it sounds like our next speaker isn't here still, so.
I'm wondering if I could help you with the volume from the microphone.
Oh, okay.
So, this used to be on. Here we go.
Oh, it's too loud.
Let's say something. Is that better?
Hello? I'm sorry, it was too loud. Oh, someone should have told me earlier. Well, I am really pleased to introduce our next speaker, who is Anita how do you say last name? McGann, yeah. And she is the Associate Dean of Research at and Chair, the Rotman Chair in Management at the Rotman School of Management of the University of Toronto. And you have her lengthy and distinguished bio in the materials, so I'm just going to bring her on up here to get on with this. And we're going to have an opportunity to have a discussion. And so please be thinking of your questions, because we really do want this to be a discussion. And then after that, we have a facilitated exercise with 2 folks who I'll introduce at that time, where the idea is to kind of make sense of all of this information you're getting about spread, scale, and sustainability. With that, let me welcome Anita.
Thank you.